Our beautiful patient had a couple of different concerns and complaints. One of them was the fact that she looked tired. She had sunken eye appearance and maybe the fullness under her eyes, so she didn't really like the appearance of the dark circles. She also did not like her profile. More specifically, she didn't like the way her nose projected, as well as how under projected her chin was. So what we decided to do is offer her a comprehensive evaluation that included under-eye correction using facial fat transfer to help smooth out the contours from the lower eyelid as well as the eyelid cheek junction. We also did a overall CO2 laser skin resurfacing. From the profile standpoint, we performed a primary open rhinoplasty. Finally, the chin was the ideal treatment for her to increase the projection and the overall balance from a profile view. Take a look, tell me what you think.